Well, staying in Akwa Ibom State, where the State Ministry of Health has confirmed 6 cases of Monkey Pox. The State Disease Surveillance and Notifications Officer, Samuel Etuk, said currently there are 3 cases in Onna local government area, 2 in Ubium local government area, and 1 in Nsit Ubium local government area. Mr. Etuk stated that contact tracing for any transmission was conducted while the affected persons had been placed in isolation. He disclosed that 10 community informants had been engaged per ward in the state to work in catchment areas to report to the health facility focal person, who in turn will forward the same to the local government disease surveillance and notification officers for an onward report to the State Ministry of Health. Well, let's get more insights on this as I'm being joined by the State Commissioner for Health, Professor Augustine Umor, for more on this developing story. Good to have you on the news at this time. So, yes, we understand 6 cases of Mpox have been confirmed in Akwa Ibom State. What is the ministry doing to address the situation?
Yeah, good afternoon, good evening. That is true. So we've recorded 6 cases, but I must also emphasize that those 6 cases have been since the beginning of the year. We had some of it in early part of the year, but recently, what we've really had have been 3 cases, starting from last month, all of them in the same local government area. And the ministry has taken steps, as the BSNO, who is also from the ministry, would have already informed you. The ministry has taken steps to ensure that those cases have been at least isolated and education provided. Because indeed, of those 3, one is the daughter of the first index case in that local government area. So we've taken steps to identify these cases, isolate the cases, provide education. Beyond that, the ministry has taken steps of revitalizing its emergency response center to be able to get responses from members of the public as to the presence of these cases, which is how we were able to identify some of these ones that have shown up. We've also taken steps to educate the public on this case, which happens to be amongst us here. And we've asked that people do not panic, but really this is the time that a lot of the things we learned during the COVID era would also still come in very useful. So we've taken steps to educate the people, isolate the ones we've had, and it is our hope that sooner or later we'll have at least some vaccine to be able to give to some vulnerable people.
And talking about vaccines, we understand the federal government recently received about 10,000 doses from the United States Agency for International Development, that is USAID. What's the level of distribution of these vaccines, and has it already been administered in Akwa Ibom State?
No, it has not yet been administered in Akwa Ibom State. And in terms of the distribution, I cannot really speak for the Federal Ministry of Health. My only worry looking at it is the fact that we require lot more than that. I think over 750,000 doses were requested at the first instance, and therefore 10,000 doses is going to be just a little drop. But it's better to start somewhere than have nothing at all. So we are happy we got that little bit. We'll really be looking forward to having more. We have not had any in Akwa Ibom State yet, but we are looking forward to it.
And talking about this disease now, we understand so far no deaths has been recorded, and you have done your best in terms of sensitization and awareness on the part of the public. But talk to us on other precautionary measures that can be adopted to slow further spread of this disease.
The disease, as we know, is one that is gotten by contact with the infected animal, or interpersonal contact with infected persons. So that is why I said earlier on that a lot of those things that we learned during the COVID era would also come in very useful here. We do advise people to stay away from people that have overt disease, And also where there are contacts with animals, so ensure that hand washing is very important, comes in very useful here. Hand washing as much as possible. We've also asked that you report any suspected cases, and also asked that people keep away from animals on undue contact that's not necessary at this point in time. Other than that, report of any issue to the ministry will also help. So keep away from contact with persons who may show symptoms. Keep away from animals who may have similar symptoms. Try and keep interpersonal, important at this, and we will take over from there.
All right, and that's where we have to leave it for now. Thank you so much, Professor Augustine Umor, Commissioner for Health, Akwa Ibom State. We appreciate your time on the news at this time.
Thank you very much.
Well, still talking health, a senior research associate of the Cambridge